What are the things we need to do in a post-op neurosurgical patients? It's very important. There's a few points which I want to highlight. First, keep the patient elevated. That is, the head of the bed elevated. Keep it at around 30 to 45-degree level because it helps in decreasing the ICP. If there is no contraindications, sometimes in certain patients there are contraindications where we cannot keep the patient head elevated, and for that we have to discuss with the neurosurgeon. Second, do suction only when it is required. Don't do suctions routinely because if you keep on doing suctioning, first of all there might be infection. Secondly, it causes raised ICP. Third, keep the patient sedated for certain periods post surgery. We generally keep it for 24 hours because if the patient fights the ventilator, then it might cause raised ICP. Okay. Next, give anti-edema measures. As indicated, as advised by the neurosurgeons, you can give anti-edema measures like 3% NaCl, mannitol. In giving mannitol, you have to be careful because there might be certain contraindications in giving mannitols like if the patient is hypotensive, if the patient is developing AKI, you cannot give mannitol. You have to stop and replace it with 3% NaCl. Okay, start feeding early. You can start feeding as to it is best to start feeding early because if we delay the feeding, it might cause many other problems. It might cause also nutritional deficit. It might cause ulcer and many other problems. So start feeding early. Give ulcer prophylaxis. Ulcer prophylaxis we give generally in neurosurgery patients. Pentop. We give pantoprazole. We give Pentop 40 mg IVOD. Give DVT prophylaxis. Apply DVT pump. When the patient is a neurosurgery patient, post-op, apply DVT pump to prevent DVT. Okay. And in certain patients, sometimes after 48 hours, after 72 hours, if the neurosurgeon says, we can give low molecular weight heparinase. Okay. For that, we have to do a CT scan sometimes to see that whether the bleed has increased or not. Okay. Then next is administer anticonvulsants because it is very important. If the patient throws seizure, then it will be problematic for the patient. So administer anticonvulsants like Lavipil, like Aptoin, Forsolin, etc. Give as advised. Okay, and for the IV bleed, choose normal saline. Avoid dextrose because normal saline is said to be mm, the osmolarity is almost near normal. We cannot give hyposmolar fluids in case of neurosurgery patients because it might cause raised ICP. Along with that, take care of the skin of the patients. Apply oil, etc. to take care of the skin of the patients, take care of the mouth of the patients, take care of the back of the patients. Avoid bed sores to these patients. Apply air mattress, okay, to these patients. And also, very important, maintain the BP. Here, we have to maintain a BP of around systolic BP of around more than 110, or MAP of more than 80 in these patients. Because if we decrease the MAP, there might be decrease in the cerebral perfusion pressure. Okay, so also check the pupillary reactions frequently because if there is anisocoria, that is different in sizes of the pupils, is one is 5, one is 2, patient is developed, then there might be an immediate concern to the patients. We might be need to immediately inform the neurosurgeon if there is irregular in the pupillary size of the people, or the pupil is not reacting, or the pupil is getting dilated. In that case, we have to inform the neurosurgeons immediately. So these are the things which I wanted to say that you should focus in a post-op neurosurgery patients. Thank you.